Thank you very much, Chief Moderator. His Excellency, Dr. Hussein Mwinyi, President, Your Excellencies, distinguished guests, ladies and gentlemen, I'll start by inviting the panelists to come and join me on the floor. And the first speaker will be Sanjay Rughani. Sanjay Rughani joined the Standard Chartered Bank in 1999. He has served in different capacities inside and outside Africa. He has been the first CEO of Tanzania Standard Chartered Bank and the first Tanzania since 2016. He has been recognized with driving significant business transformation in his role as a CEO. He has won many accolades for his position and through the strong leadership representation with the different important thought leadership forums. Sanjay Rughani, who is also a good friend of mine, is the chairman of the Professional Accountants in Business Committee of the International Federation of Accountants. He's the current chairperson of the CEO Roundtable, deputy chairman of Tanzania Bankers Association, executive member of Tanzania National Business Council, and the director of Association of Tanzanian Employees. Please join hands to welcome Sanjay Rughani. Our second speaker is His Excellency Donald John Wright. Donald John Wright is an American physician, government official, and a diplomat serving as the United States Ambassador to Tanzania since 2020. As a medical doctor and a career member of the Senior Executive Services, Dr. Wright has served in acting and a permanent position in the U.S. federal government, including the Secretary for Health and Human Services, which is the Minister for Health in the U.S., Assistant Secretary for Health, Principal Deputy Assistant Secretary for Health, Deputy Assistant Secretary for Healthcare Quality, and the Deputy Assistant Secretary for Health, Disease Prevention, and Health Promotion. Over his course of his career, Dr. Wright has been the forefront of efforts to improve public and population health in the U.S., including disease prevention, health promotion, healthcare delivery, healthcare quality, occupational health, emergency preparedness, healthy aging, and the elimination of health disparity. He has also played a leading role in efforts to enhance community and hospital emergency preparedness for natural disaster, act of terrorism, and pandemic influenza. Please welcome Honorable Your Excellency, the Ambassador of the United States of America to Tanzania. Our third panelist is Dr. Fatma Mrisho. Dr. Fatma Mrisho is a world-renowned public health specialist in reproductive and sexual health. She has served as Executive Director of Tanzania Commission for AIDS for about 9 years. And this was after being the UNFPA country representative to Uganda. She has also served as the UNFPA Regional Reproductive Health Advisor for English-speaking countries based in Ethiopia. She has also served in the Ministry of Health Tanzania as the Director of Preventive Services, Faculty of Medicine under the Department of Community Health at the Muhimbili School of Medicine. She's a Makerere graduate, and she has a postgraduate diploma in public health and a master's in human nutrition from London School of Hygiene and Tropical Medicine in UK. Please welcome Dr. Fatma Mrisho. Our last panelist is Dr. Laurean Ndumbaro. He's currently the Permanent Secretary in the President's Office, Public Service. For the last 6 years, he's a guru in this particular area. He was a political advisor to former President Mrisho Kikwete for over 8 years. He has also been a senior lecturer at the University of Dar es Salaam for over 8 years, but he has also served as an administrative officer in different capacity in Songea and the Tanzania Coffee Board. He has published many papers on governance, human resources, parliament, and democracy. Please welcome Dr. Laurean Ndumbaro. To set the ball rolling, I will start with the lady, the only lady in our panelists, Dr. Fatma Mrisho. And the discussion is about universal health coverage. As we all know, for all those that don't know, universal health coverage is about access to health services to the people when and where they need it without suffering financial burden. Universal health coverage has 4 key pillars, one of which is health promotion, health prevention, curative, rehabilitation, and palliative care. Universal health coverage is not a new thing. We have the primary health care from the Alma-Ata days, 1978, but it was solidified in 2018 after the Astana declarations. Dr. Fatima Mrisho, what do you see as the major gains in universal health coverage in Tanzania? What are the challenges that you see, and what do you think needs to be done? You're most welcome. Your mic, please.
Thank you, Mr. Moderator. As you've indicated, universal health care is not something new, and it has been ongoing, I would say, post-independence. And the gains, I would limit myself to reproductive health, which was my agenda. Some of the gains that have been seen would be discussed later by the person who's going to talk about child health. But I would say that is where we've made the biggest gains in health. The other gain that we have made is reduction of a number of diseases, particularly diseases that are preventable, immunizable. The other gains that we have made is increase in health workers. I remember once speaking about population policy chaired by Mwalimu Nyerere, and at the end of my discussion, he commented that, when we were asking for independence, we were asked, why do you want independence when you only have 4 doctors? And look at a person like her, and she represents many, many more. And even then you could see the growth, incremental growth in the number of human resources for health, although I would later go and say that is also a constraint right now. And I'm so happy to meet Mr. Ndumbaro, because I hope I will have time to discuss some issues with him in private. The village health worker started very early, and that was, I think, the first indication of Tanzania's seriousness in universal health coverage. So, thank you. So we've made a lot of progress. Currently, as I speak, we have IT in health, which is a major game changer, I would say. We also have a lot of several high-level consultants and technicians who can manage pretty much every disease that you can think of in Tanzania. So that is from the higher level, but also from the level right down to the village, where we started with village health workers, and we now have community health workers, as Ellen aptly talked about. So we also have a number of infrastructure and still growing. Initially, we were supposed to have a dispensary per a population of 5,000. Currently, we have some dispensaries with inpatient facilities, but also almost all health centers having surgical facilities, and the number grows. We also have existing infrastructure schemes of various types, some trials by non-governmental organizations, but a number of them, as indicated in Ellen's discussion, National Health Insurance and the Improved Community Health Fund.
So, Dr. Mrisho, thank you very much. You've highlighted some of the major gains on the human resource development, vaccine preventable diseases, infrastructure, and all that. I know you're an expert in reproductive and sexual health, and you've worked in that area for a number of years. Despite all these major gains in the health sector, we still have some challenges. When you look at the maternal and infant mortality rates, these are still very high. Teen pregnancy is around 27%. If you look at young people, and they are actually most disadvantaged. Look at the HIV statistics currently among new infections, 40% among the young people, and within that 40% is the girls. So what are the key unmet needs and related barriers, and what do we need to do in order to address the situation? In 2 minutes.
In 2 minutes?
Yes.
Okay. I would start with inadequate human resources for health across the board, but especially for midwives and pharmaceutical assistants. And I would like to underscore midwives, and midwives, particularly in relation to reproductive health. Resource availability. We have a wonderful health sector strategic plan, number 5, and it is costed. It's the expectation that it would be fully funded. If it is not, we will not be able to meet the targets. We need to finalize the National Health Insurance Fund and Improved Community Health Fund bill and submit it, table it to the Parliament. We need to raise awareness and popularize health insurance as a strategy nationwide. We need to raise awareness on the plight of maternal health, infant health, which also includes the first 28 days of life, which is a reflection of the health of the mother, by the way. And we also need to address the issue of cultures that mitigate against health and welfare of children, adolescents, women, and few men. My 2 minutes are up.
Yes, Dr. Fatma Mrisho, I think we'll end here. I'll come back to you. My second speaker is Dr. Laurean Ndumbaro. As I'd introduced him, he's the Permanent Secretary, President's Office, responsible for public service. Universal health coverage requires competent and motivated health workers at the community level who are equitably distributed and adequately supported. We know as a government we've made a lot of investment in the health sector, and we've, in the recent years, we've invested a lot in terms of building infrastructures. And with this achievement, it has come with its own challenges. Currently, the human resource gap in the health sector stands around 52%. So what solutions do we need to come up to make sure that we bridge this gap? And then particularly in this area, we have invested in training human resources for health. Some of them are employed, some are still in the streets. How do we work on this huge population of health workers who are not employed, but we need them in the health services? You're most welcome, Dr. Ndumbaro.
Yes, thank you very much, Mr. Moderator. The government has been working hard, I think, from independence. As you all know, we had not even enough personnel. So in the first 30 years of independence, we used to expand training for health sector, professions and others. And also the professions are changing now and then. So we've also been upgrading the professions now and then, so that in the current situation now, we have more health professions who are not employed. And so the government is employing 3 major strategies in dealing with this. The first one is the usual one, that continue to employ year after year. And in this financial year, actually the government has allocated more than 11,000 vacancies for health workers that will be employed in this year. But the second strategy is to work with non-state actors like the Mkapa Foundation. You have heard that the Mkapa Foundation for the last 15 years has recruited or has deployed more than 9,000 health workers who are working in government health facilities in remote areas. So the government is creating an enabling environment for non-state actors to complement government efforts in various areas. And the third strategy that we are working on is to try and develop a volunteer program working framework that will allow us to absorb those who are not employed as volunteers to work in the different government facilities. And our focus will be mainly borrowing from the Mkapa Foundation, the spirit of Mkapa Foundation, to deploy them in the remote areas where, the only facilities that you can find there are government facilities. And if you don't have workers, then, it becomes a crisis. So we'll develop the volunteer program framework that will enable us deploy volunteers to those areas. Those are the 3 major strategies that we're going to use.
Thank you very much, Dr. Ndumbaro. As we are discussing about universal health coverage, we are all aware that the pattern of disease is changing. In the early years, we were focusing on communicable diseases, but of late, we are seeing a new pattern of non-communicable diseases, which are very different, by the way. With communicable diseases, you get sick once, you get treated, you never go back to the health system. With the non-communicable diseases, once you get sick, you are permanently fixed in the health system for the rest of your life. So you're seeing this changing burden of disease in Tanzania, with non-communicable disease on the rise. but also the advent of COVID-19, which builds a strong case to invest in communities' health promotion and health prevention programs. What do you see the role of community health workers in this setup?
Thank you, Mr. Moderator. I agree with you that the community health workers, employing them is a good idea, but we should also go back to our rich history of dealing with this type of things. I remember in the 1970s and 80s, when we had communicable diseases problem, we used to have sustained health campaigns, across the country. Mtu ni afya, chakula ni uhai. These campaigns, were sustained. Leaders from the national leaders, the region, district, even the world level, were all singing the same song, campaigning for mtu ni afya, chakula ni uhai. And this, was a cost-effective type of thing, a campaign that, raised the consciousness of the people about these communicable diseases. We can use the same experience in dealing with non-communicable diseases, that we can, start a national campaign, at all levels, all leaders, from national, district, region. If all of them will talk about this, people will understand, and then we'll address those issues. I also remember, our history. When we were in primary school, we had a subject called Hope Economics. And that's Marifa Nyumbani. In that subject, we had been taught about how to handle these communicable diseases, diarrhea, chorea. Students were taught in primary schools. And so if we also mainstream health education in the primary school, secondary school, this will be a long-term sustainable solution, in addressing this problem. But we can also employ as you said, the community health workers, but in areas where, you have significant outbreak of these things. And this will be, I think, a more cost-effective thing if we employ community health workers in those areas where, there are extreme cases, areas of extreme cases. But we can also, as I said, embody it or mainstream in the primary school, secondary school, health education, and then people will be more aware of that. Thank you.
Thank you. Thank you very much, Dr. Laurean Ndumbaro, for those wonderful remarks, and I'm going to give you time to wrap up at a later stage. My third speaker is Mr. Sanjay Rughani.
Thank you.
Who is representing the private sector. And as you know, the private sector is an important partner in the journey towards universal health coverage. How do you see the private sector complementing the government's efforts towards universal health coverage?
Thank you, Mheshimiwa Waziri. And I think we very significantly contribute. But I think it's just to take a moment on what private sector means. So I think as a nation and across Africa, 80% of whatever is produced in our countries comes from private sector. 75% of the total credit that is taken in most of our countries is taken by private sector. 65% of the total investment in any country is done by private sector. And 90% of the people employed in the formal sector are employed by the private sector. So that's the strength and the machinery that the government or any nation has. And I can tell you that in every country where there's been progress in the health system, it's really because there's been significant collaboration. I must also say that, when you talk about universal health coverage started in 1978, if I remember, 43 years ago. When we started universal health coverage then, the role of the private sector was just a little bit of production, a lot of procurement, and a little bit of distribution. Now, statistics shows that anywhere between, in a year, from 25% to 40% of the contribution in the health sector could be from the private sector. We've scaled up significantly. We are now involved in knowledge, in education. Mheshimiwa talked about campaigns, services, products, goods, manufacturing, value chain impact. We are using technology as an enabler. A lot of work is happening on logistics. Like I said, 80–90% of the total distribution happens through private sector. We've also really expanded on our partnerships. You know, in olden days, and Mheshimiwa Balozi will talk about it, that in the past, you know, the donor agencies could just fund us. But now we are creating economic sustainable models, and that requires private sector. So we have had partnerships with various development partners, with UNICEF, with AMREF, and that's a big thing we've done. Also want to say that the private sector is what finances a lot of the interventions that we do. Now, just citing a couple of very quick best practices. I mean, Tanzania has made so much progress, including through Mkapa Foundation. I mean, we boast of some of the best hospitals now. So, you know, if I talk about Aga Khan Hospital, it is amongst the 9 accredited hospitals in Africa, and we don't even know about this. They do a lot of work on cancer, on gender equality, CCBRT, you know, from a disability, eye care, gender perspective, do phenomenal stuff, and this is all private sector interventions. The financial services industry, Standard Chartered Bank, where I come from, we've spent $7 million in the last 5 years just on eye care. ICNBC, my friend sitting there, CRDB, NMB, everybody is putting in a lot of effort. We need to just coordinate these efforts. You look at mining companies. You look at Dalberg that is doing a lot of research work. And then finally, MNOs, you know, I think are very critical as we evolve. And, you know, data is going to continue to be very critical in essence. And finally, I would say that, you know, when you talk about private sector, whilst we have done a lot to manage the burden so far, the burden of health, and I know that COVID has taught us, is very, very huge. Just in terms of statistics, if you look at Africa, 11% of the world's population is in Africa. 24% of the total global disease burden is in Africa. We only have 3% of our workforce that is involved in health, so we have a lot much more to do. And only 1% of the global investment goes in Africa health. So there's so much more to do. Thank you.
Thank you for that intervention. If I don't ask you, I'm not going to sleep tonight because I'm the minister responsible for communication, but also the digital transformation in this country. You've highlighted some of the issues here and the engagement of the private sector. How do you see the role of digital transformation and the technology in filling the gaps that you see in the health sector from the private sector perspective?
Waziri is talking about his house now, ICT. I think ICT can give us exponential transformation, you know, whether it is in health or many things. But if you just talk about health, you know, you talked about communicable diseases, non-communicable diseases, or pandemic now, you know, because it's a big thing. So whether it is in the adaptive technology, you know, what is adaptive technology is we are a very resource-constrained country. And a lot of the equipments that we need to be made for resource-constrained countries. And these are technology interventions. So whether you use GE or many other organizations, Philips, you know, they can be of huge support. But let's talk about data, because that's where you come in. And I must congratulate you because your ministry started only in November last year, and you've already started to involve us in making the blueprint, which is very important. So here is the magic. If we collected all the healthcare data from the providers, if we collected all the MNO data on the population, the concentration, and you know, the social behaviors, if we collected all the data from financial services, the utilization, from all the food chains, and how we consume food, from the bottling companies, from insurance providers, human resources, as we talked about. Imagine the data we have to make good decisions. So,
Madam President, Your Excellencies, distinguished guests, ladies and gentlemen, now I will let Mr. Sanjay Rughani to complete 1 minute of his intervention, and I asked him what role can technology play in order to bridge the gaps in health systems. 1 minute.
Good, and thank you, Waziri. And we are talking about technology in terms of adaptive technology and data. And I think we had covered adaptive if we were talking about data. And I said that data for development is very critical. It gives you exponential opportunity for scalability. And we talked about healthcare data, MNO data, financial services data, food industry data, bottling company data, insurance company data, and human resource data. And I said with your ministry and the fact that we are doing a blueprint, it was really going to help us in decision making, workforce management, health commodities, which means supplies and production, and also investments. And I think finally it also helps us for partnership management, because in which areas we need to focus. So I think I would end at that for now. Thank you.
Thank you very much, Sanjay. And our last panelist for today is His Excellency Dr. Donald J. Wright, the U.S. Ambassador to Tanzania. Dr. Wright, Tanzania has made huge strides in the health sector in partnership with the development partners. What are the initiatives or strategies that DPG and the USG have been implementing to support the journey to self-reliance and universal health coverage? And what do you see as the successes? And what opportunities do you see that need to be capitalized on?
Thank you. Thank you very much for the question. Well, as it relates to self-reliance, let me assure you that the United States is committed to promoting self-reliance in our partner countries around the world. In Tanzania, this is particularly appropriate because the country was founded under the principles by the late father of your country, Julius Nyerere. And that commitment to self-reliance has been championed by successors, including the late Benjamin Mkapa. The United States has a long-standing bilateral relationship with the people and government of Tanzania, and this year we're celebrating 60 years of working together, Pamoja 60. As it relates to the development partners, let me say that over the last 20 years, Tanzania's Health Basket Fund has proven to be an excellent mechanism for strengthening Tanzania's health system and delivering results for the poor and vulnerable. This project brings together resources from multiple international development partners into government health systems to work on achieving agreed upon goals. While the United States does not contribute directly to the health basket, we have seen the effectiveness and support joint goals through the provisions of technical assistance. As it relates to UHC, let me say that the efforts of the development partners to support universal health coverage aims at supporting the government to increase access to health services when and where they're needed, without financial hardship and without compromising quality. Tanzania is not there yet, but development partners have supported the government of Tanzania to develop systems, policies, and strategies to enact universal health coverage through a single health insurance policy. As it relates to the successes, let me say I would first like to take a moment to recognize the efforts by the government of Tanzania in reaching lower middle income status ahead of schedule. This demonstrates great potential to reach new development milestones, and we are committed to supporting Tanzania to achieve these. In our mutual goal of Tanzanian self-reliance, we must focus on sustaining and improving these economic gains and translating them into real increases in household incomes and the ability of each individual citizen, particularly in the rural areas of this country, to access quality health care. We development partners are committed to strengthening collaboration among ourselves and ensuring that our development support is well coordinated as we engage with our government counterparts. There are certainly opportunities to improve our partnership with the government of Tanzania and ministries and departments, and hope they will commit to the same level of coordination.
Thank you very much, Ambassador Wright. And now To wrap up our discussions, I'll start from far left. Sanjay, I'm going to give you 1 minute. The president is here. The president of Zanzibar is here. 1 minute takeaway message. What do you want the president and the congregation to hear? 1 minute.
Okay, 43 years since we started universal health coverage. Our commitment is by 2030, we are going to hit massive milestones. How are we going to do that? My message to the government, and since the president is here, is the partnerships we have seen in the last 43 years are wanting. We need to have real partnerships so that we achieve our targets in the next 7 years. My contribution to the private sector, the CEOs who I work with, is that including COVID-19 has taught us that investment in health drives economic prosperity, and economic prosperity drives business. Thank you.
You want to see more partnership and engagement of the private sector?
Absolutely.
Ambassador Wright, 1 minute. What prioritized action leadership and the stakeholders need to undertake going forward?
Thank you. Well, let me begin by quoting one of our former presidents of the United States, George W. Bush, who founded the PEPFAR program and launched global investments in fighting HIV and malaria. He once said, Africa's most valuable resource is not its oil, is not its diamonds, it's the talent and creativity of its people. Madam President, I urge you to continue investing in the people of Tanzania, particularly the youth. One of the most critical needs faced by Tanzania today is human resources for health care. In some remote areas of the country, 70% of healthcare positions are vacant. And overall in Tanzania, the vacancy rate is about 52%. While we've seen important strides made in increasing public sector hiring, critical shortages exist, which are particularly problematic for reaching goals around reducing maternal mortality. Midwives and doctors are needed to provide essential maternity care. More progress must be made quickly to expand all cadres of the health system to enable the nation to be resilient in the face of COVID-19.
Thank you very much, Ambassador Wright. You mentioned that we need to invest in the people and also build the capacity in the human resource for health. Dr. Fatma Mrisho, you've been very passionate about reproductive and sexual health. Now is the right time for you also your message to be heard. What is your 1 minute take-home message?
The first one is fully finance the 5th Health Sector Strategic Plan. I keep on repeating this because the 5th Health Sector Strategic Plan is for strengthening the health system. The second one is I keep on repeating, invest in human resources for health, particularly the ones that are missing most and key to reproductive health, since that's my topic. Midwives and pharmaceutical health assistants, very key. The third one is make maternal and child health issues a national priority, in collaboration with non-state actors, particularly non-governmental organizations who are very capable, increasingly showing capacity in this country, as well as the private for-profit sector.
Thank you, Dr. Fatma Mrisho, for that very powerful closing remarks. And I'll end with Dr. Laurean Ndumbaro. One minute take-home message.
Thank you very much. I think the first one is we should use the experience of 1970s and 80s in raising awareness of people against non-communicable diseases. And the second one is that as we work on the volunteer program framework, I think we continue to work, we'll need engagement of various stakeholders so that the government in long-term perspective may approve that framework, and you can start using volunteers in these remote areas. Thank you very much.
Thank you very much, Dr. Ndumbaro, for those remarks. You are mentioning that we should revisit. This is not a new experience, although the burden of disease has changed, but the best practices from the past that we can revisit. But also, I'm happy to hear that you're talking about the volunteer program framework, whereby we can engage the unemployed health workers to provide service while we are building the capacity, and use them when you employ them, because they'll be providing service, but also they'll be getting the substantial experience while they volunteer in the health system. Now, I've wrapped up with the panelists. Now, I would like to welcome contributions from the floor. Okay. Yes, I've seen some hands. And I'll start with Dr. Khalid, the Minister of States, Vice President's Office, Revolutionary Government of Zanzibar. Could you pass on the mic to Dr. Ali? Dr. Khalid Mohammed is the Minister for State.
Thank you.
Dr. Khalid, you have 3 minutes.
Thank you, Mr.
3 minutes. Yes. Yes, sir.
Moderator, for giving me this opportunity to give my comments to the panelists. Excellencies, distinguished participants, ladies and gentlemen, first let me commend the Benjamin Mkapa Foundation for organizing this important event. I also commend the moderator and the panelists for the very insightful and enlightening discussion. My humble comments are centered on the need to have a multisectoral approach and effective coordination mechanism in health-related issues. As we all know, the health sector has numerous sectors, as already said, but having different roles, objectives, and approaches in supporting and in the provision of healthcare services. These actors included the government, donor agencies, private sector, NGOs, CSOs, and others. But within the government itself, we have different institutions having different roles, and all those can contribute positively to achieve positive health incomes. We have, for example, Ministry of Agriculture. It has got a role of making sure that we have adequate, nutritious food for good health. Ministry of Water, for making sure that what we drink is clean and safe. Responsibilities for the Ministry of Communication and Infrastructures to ensure that connectivity that allow people to have an easy access to health facilities. And all this calls for intersectoral linkages and coordination. But also looking at the Ministry of the Ministry of Health itself, there is also a need to have internal intra-coordination. If you look at the aspects, 3 important aspects: the health structure, we have the primary healthcare units, we have the district, we have the region, and we have the referral hospitals. All this needs to be interconnected and to have effective coordination within the organization itself. But even personnel, we have practitioners, we have specialists and other supporting staff. They also need to be connected, and therefore there is a need for intra-coordination within the organization itself. services that are offered. We have different services that are offered in the health sector. Diagnostic services, for example, epidemiology services, drugs and treatment, logistics, and all these call for effective coordination of department sections to make sure that they all work in a more coordinated manner and not working in silos. My personal view is that health issue being multisectoral in nature, it needs multisectoral approach and effective coordination both sectorally and centrally. For the central coordination to be effective, I think we have to define an overarching objective and a common goal in the health sector. Once we define that, stakeholders' roles and activities needed to be streamlined to make sure that we achieve the defined goal.
Thank you very much, Khalid,
Thank you very much.
for that very informative contribution. I saw Charlene Bahuguma, representative of UNICEF. Please, you can now have your floor. You have 3 minutes, Charlene.
Asante Sana, Excellencies, ladies and gentlemen, all protocols observed. It's a privilege to be able to speak today at this prestigious event. Truly, President Mkapa's vision was exemplary because he put human resources and human capital first, understanding the need to invest in children, in education, in health, in social sectors, in social protection, and in prevention of violence against women and children. So indeed, we are standing on excellent progress that the country has made since then under the different leaders, including today with Her Excellency Mama Samia at the lead. So let me start with the first thing. You know, all the contributions today talking about health systems resilience stand on one fundamental transformational issue, and that is the equality between men and women, boys and girls. Unless we have all girls who enter school exiting, today we only have 1/3 of girls who enter primary school exiting and making it into secondary education and out into the world of work. Unless we address this barrier, we will continue to get adolescent girls who are mothers. We will continue to have girls who don't have access to health, education, and other rights, and their families won't have access to those rights. So working concertedly on addressing these gender barriers has to be at the heart of health systems work, because without this, we will not achieve those results. And I'm proud to say that with Mama Samia's leadership, she has already flagged this as a top priority. The second issue, and it is linked very much to health, is the issue of sanitation and water. This too has been flagged by various people, but I do want to say that currently we've made huge progress, but still less than 50% of households have access to hand washing or sanitation. If Ebola and the COVID-19 outbreak have shown us anything, it's that we have to consistently invest, including in social norm change, so that Tanzania can become the leader in not just East Africa, but Africa in these statistics, because they underpin access to health and indeed access to better nutrition and better health. And the last point—
Last 30 seconds.
Last 10 seconds is, my colleague said convergence. Tanzania has excellent frameworks and policies. The National Accelerated Action and Investment Agenda for Adolescent Health and Well-being that was recently launched, the National Adolescent Health Development Strategy. We're developing an early childhood development framework with parliamentarians leading this, looking at children as a composite, as a whole, and multisectoral services to them will unleash Tanzania's potential. And indeed, not just low middle income, we can move up to high-income country status with that. Asante.
Thank you very much, Charlene. Now, I saw Dr. Malina Njerekela, the Chief of Parts of Boresha Afya. I'm going to give you 1 minute. Pack your message and a take-home message in 1 minute.
Thank you very much, Moderator, Your Excellency, the President of the United Republic of Tanzania. My 1 minute message to you, Moderator, and the panelists is that we are talking about universal health coverage. We cannot discuss universal health coverage without taking into consideration emerging infectious diseases such as COVID-19. And you have all put it very clearly, in order to implement well the strategies to fight these pandemics, the issue of human resource, the issue of data, as Sanjay has said, the issue of partnerships from the US ambassador. These are some of the 3 major issues which we need to address as a country, but also political commitment is important because all these partnerships will be forged through political will. We are seeing very clearly how our president is taking up the role of fighting COVID-19, and we will follow suit. Thank you very much.
Thank you very much, Marina, for that very wonderful contribution. Now, I saw Dr. Florence Tem, the Executive Director, AMREF. Also, you have 1 minute.
Thank you, Moderator, and Her Excellency, our President, and all leaders. It's my pleasure to be part of this contribution, and I congratulate Benjamin Mkapa, together with the government of Tanzania, for arranging this symposium in a very special way to mark the legacy of our late president. My 1 minute contribution is actually to contribute to the role of the implementing partners. And here I mean the non-state actors and the NGOs. It has been well said by Dr. Mrisho there, but I want to indicate that as we do the implementation as NGOs or NSAs, we are working both on the supply side, but also on the demand side. And we're actually working with from the national level down to the community level. That means our contribution is actually aligned to the national priorities and the global priorities. At the same time, we're influencing the change that we intend to see. And on the supply side, we're also looking at the 6 building blocks of the health systems, but also on the demand side, ensure that communities' knowledge and access to knowledge about health services, but access to services is also being attained. In so doing, much as we are supporting the government and also the capacity building, we are also building our own capacities. So in fact, there's a lot of capacities among the implementing partners, and so I encourage our funders, the government, to continue to support NGOs. We have seen evidence from Benjamin Mkapa. My second point is on the sustainability.
Just
1 minute, just sustainability issue. That's very important. Talking of sustainability, we are looking more on the financial sustainability. But in fact, you should also look at the institutional sustainability, but also social sustainability. Talking of institutional sustainability, I mean, even NGOs, I think it's high time to also finance our strategies, apart from just projects, support NGOs to continue to exist so that they can support all these concerted efforts that are really important in sustaining our intended goals.
Thank you. The last contribution from the floor will be Ken Kwaku. Mike? Yes, Ken Kwaku was the World Bank Country Director, former, but also an advisor to President Mkapa. You'll be the last contributor from the floor. The mic, please, to him. Now you need to have a mic.
I will make 3 basic points on what I've heard so far. First it is important that we follow the concept of self-reliance in all of this. I think the reality of what has come out of the COVID-19 in terms that every country, every region is taking care of their own. We cannot build our health systems as we've tried to build our development progress on handouts or expecting others to take care of us. We must make taking care of ourselves #1 priority, both regionally, continentally, and nationally. That is #1. Secondly, I think, and this cooperation for our own development can take place in better trading. You know, we now have the African Continental Free Trade Area, medical research, manufacturing of antiretrovirals, etc. All of these must be homegrown within Africa. I think the problem of sustainability also depends on the empowerment of women and girl children. This is central to the health education, sexual health education effort, the empowerment of our women in all aspects. Thirdly, I think it is important that we involve African local traditional leaders in the advocacy that we are doing with the use of our own languages. In East Africa, you are lucky to have Kiswahili, which is broad, but in many other parts of Africa, you have dialects, etc., that are not integrated into the advocacy and the messaging. At the same time, we need to examine the relevance of our own moral standards and cultural practices in sexual education. We don't have to necessarily follow what the Catholic Church or what Western morals tell us. So that is, we must really use our own traditions to determine what our behavior must be. Those are just
Thank you very much, Dr. Ken Kwaku. I think we have come to the end of these panel discussions. And the take-home message is that I'm getting from the panel discussions that I'm seeing the willingness and the commitment to collaborate and support the government initiatives from the development partners, from the private sector, and also from the non-state actors. The message was also very clear that we need to invest in young people, women, and health of the children. We need to support and invest adequately on the Health Sector Strategic Plan 5 in order to build a resilient and a robust health system. We also need to invest in a human resource for health and adopt innovative approaches to address the human resource gaps. We need to revisit the past experiences in order to come up with a strategy to address the challenge that we are currently seeing in the changing disease pattern, especially with the advent of non-communicable diseases and the COVID-19. But we also need to have a proper coordination and a multisectoral approach towards universal health coverage. But lastly, use of data and technology in addressing and building a sustainable health system. Thank you very much. It was an honor for me to chair this and moderate these panel discussions. And thank you all the panelists and all the contributors from the floor. And now return the mic to the chief moderator.